Dr. Dode Washington is an OBGYN who delivers babies at the birthplace at Conway Medical Center. For her pregnant patients, she recommends centering. That's where, rather than a traditional doctor's visit, the prenatal checks are done in a group setting, although there is private time with the provider.
Centering is a new way of providing care for our patients. It is much more fun, and the patients spend 10 times more with the time with the provider than they normally do. So you will come in as a patient, it's groups of 10, maybe 8 to 12 patients. You do your blood pressure yourself, you check your own weight, you have a quiet, private time with the provider, we call it the tummy time, who will listen to the baby, and if there's anything private you want to discuss, you talk about it there. And then the rest of the visit, which is about an hour, you sit in a group with women who are due about the same time that you are. They become your friends, and you have a conversation and talk, and there are 10 visits, and each visit has different things to talk about. So we talk in depth about breastfeeding, why we should, why we recommend it, or reasons why not to breastfeed. We will talk for a long time about postpartum depression or just anxiety or family issues, support structure, what are you going to do if, who will take care of your other children if you have any. And we talk about issues with sexuality during pregnancy, should you exercise, and all of the things that my mother said, my aunt said, don't do this, and what we call them, you know, the old tales. And we talk about that, and everybody talks. It's not a lecture, it is more like a conversation amongst women. It is for new first-time moms, and even if you've had 1 or 2 babies, they come and then they really contribute to the group as well.
So does this replace traditional prenatal care?
That is what you do instead of the traditional. You come, you will know all of your visits at set times. You know it starts at this time and will end at that time. And whereas if you come to see me or one of the other providers for a regular visit, I might be running behind, so you might wait 10, 15, 20, half hour, an hour. We don't want it to be that long. But with and it's going to be 5, 10 minutes is all as well. And we don't have time to really dwell into, you know, discussions for so much. But here, you always start on time, you always end on time, and it's the patients love it. And this is a transitory community for many, and so you might not have a close family, but when you go to the centering, you get to meet other people. And so after the baby's born, we also have a postpartum visit where you bring your baby in, and so you talk and support each other. We've done it for about 2.5 years, and it's really a wonderful experience for the patients.
Our patients with complications seen more often.
If they are high risk and they need to be seen more often, then they will also get seen individually in the practice. Every week, or they might have to be monitored. We check the baby, and that's separate. But with the centering, it is every 4 weeks, and then it goes to every 2 weeks at about 32 weeks. And then always, if they need more care, we will provide them with that extra care.
And why is regular prenatal care important?
Prenatal care, really, there's a few things that can go really wrong in the pregnancy, and one of the big ones is the preeclampsia or toxemia of pregnancy. And there are often signs before it really is full-blown. So prenatal care really was designed to make sure that we check the blood pressure of the patient and any signs and symptoms for that. Of course, diabetes, now that everybody's eating too much, is more rampant now. So you have to check for the diabetes and help them with those things as well. So prenatal care is very important. So we do blood work, and it's the same for every pregnant patient. And for that blood panel, you check for syphilis and hepatitis B, HIV. You don't distinguish who is at risk and who is not. And you check the blood count and make sure that they are not anemic, and if they are, you supplement them. We have lots of patients actually who've had gastric bypass, so they also have more nutritional deficits, and you can check on that and you can supplement them. And they might have thyroid problems, so there's so many things that can come concurrent with while you're pregnant. And when you come, we will take care of those things with you, and we will make sure that we optimize your pregnancy. And with the centering in particular, the studies show that you decrease the risk of preterm delivery. which is huge because we want healthy, full-grown babies to be born.
Just how serious can the complications of pregnancy be?
They can be very serious. Often people say, I just want to be all natural, I don't need to calm, I'm fine. We forget that in other parts of the world, particularly in Africa, the number one reason for a woman to die is childbirth. I mean, things can go bad, they can go bad quickly. So it is important to come just to get your checkups. Like I mentioned, the preeclampsia, the diabetes can go, if you don't check your sugars and you are out of control, it has consequences for the baby. It can be too big. It can have problems with its own blood sugar regulation when it's born, and particularly if it's too big, it can be a very difficult delivery. And there's even recommendations for doing C-section if the baby's a certain weight before it's born, because it can lead to death otherwise.
What lifestyle changes do you encourage for pregnant women?
There's a lot of smoking, so this is a time where women also can start new beginnings. She's encouraged to particularly stop smoking. We have smoking hotlines, so we talk about that. It's good to be encouraged to do. We tend to do better when we know that we are carrying life inside of us. So we're just glad to be part of that journey for the woman.